Hello, my name is Theresa Stack. I'm an associate professor at Montana Tech, and this learning unit is upper extremity work-related musculoskeletal disorders, and it follows the first half of chapter 13 in our text. Our objectives for this learning unit is to just remember or recall basic anatomy of the upper extremities, to become familiar with different types of musculoskeletal disorders of the upper extremities. So when we say upper extremities, we think shoulder, elbow, forearm, hand, and fingers. And this won't include all of the musculoskeletal disorders, but some of them. So the goal here is for you to understand why it's important to maintain or keep the neutral posture as much as possible, to see how the physical workplace risk factors lead to the development of work-related musculoskeletal disorders so that you can better fit the workstation to the worker and prevent these disorders from occurring. So I'm just going to go over some basic terminology before we begin. Work-related musculoskeletal disorders is the term that OSHA uses, and therefore we use it predominantly in the United States. But if a physician was trained someplace else, or if they learn different terms, you may hear the term cumulative trauma disorder, repetitive motion injury, repetitive stress disorder, or overuse syndromes. And these are all the same type of soft tissue disorder associated with part of your job as the causation of developing the musculoskeletal disorders. So carpal tunnel syndrome is a work-related musculoskeletal disorder, and pain is not a musculoskeletal disorder. Pain is a symptom. Sometimes you see pain listed as the disorder, and it is not the disorder, it's just a symptom of the disorder. Musculoskeletal disorders, if you are having trouble remembering them, think of the two pictures, your muscle system and your skeletal system. Musculoskeletal disorders are generally not caused by acute trauma, but occur slowly over time due to microtraumas or repeated trauma or damage to your soft tissues. Your muscles, your tendons, your ligaments, your cartilage, and your blood system, your blood vessels, as well as your nerves. Now, of course, your bones are a harder substance, but that's also considered part of your musculoskeletal system. Work-related musculoskeletal disorders are musculoskeletal disorders that are caused by or made worse by working methods. They occur when the physical requirements of the job do not match the physical capabilities of the worker. If you see a disorder that ends in itis, it means inflammation of. So tendinitis is inflammation of a tendon, whereas arthritis is inflammation within a joint. Women are 3 to 11 times more likely to develop a musculoskeletal disorder of the upper extremities than their male counterparts. Researchers believe this is true because of the genetic differences and women losing their bone density as they start to age, and this causing the breakdown of the tissue, which leads to an upper extremity musculoskeletal disorder. Also, previous to the 1980s, women tended to self-select themselves into jobs that required more repetitive hand motions and upper extremity use of their body, and therefore they were more likely to develop a disorder in that part of their body. And always it's a physician who diagnoses musculoskeletal disorders. So this learning unit is not made to in any way have you diagnose a musculoskeletal disorder, but just to be familiar what's out there and how the exposure to your physical workplace risk factors can lead to the development of one of these disorders. So we're predominantly concerned about our skeletal system and our striated muscles. We have 206 bones in our human skeleton, and they make up our framework. But they're held together. Bones are connected to muscles via our tendons, and bones are connected to each other via our ligaments. So bone to bone is our ligaments. These are dense, fibrous materials, very stiff. They create the stabilization around our joints. And then our tendon connects our muscle to our bone. So when our muscles contract, our muscles only have one action, and that's called contraction. When they contract, the muscle pulls on the tendon, which pulls on the bone, and you get an articulation around the joint. So I do have an arm here, which is falling apart a little bit. But you can see that there's nothing that holds the bones together in the hand and all the different bones that are in the hand. Your muscles that allow you to move your hand are predominantly in your forearm, and they're attached at your epicondyli, which is around your elbow. And then you have those muscles run, of course, in the forearm. The tendons run from the forearm to the ends of your fingers. They run through ligament structures that run in the opposite direction. Generally speaking, your muscles run in the same direction as your tendons run because your muscle would contract. It'd pull on the tendon and it'd move the bones and cause that articulation. And your ligaments run in the opposite orientation, which hold the muscle or the tendon to the hand. So here in the hand, you have a bunch of dense ligament structure that runs this way, creates a joint capsule, not only holds the bones together, but creates a place for that fluid to go, that synovial fluid, which creates that lubrication inside the joint. So one way to think about it is your muscles are your motor, your tendons are your cables, which hold your which enable the contraction of the muscle to generate the force to the bone and cause that articulation around the bone. Also, another important thing to remember about recovering from a musculoskeletal injury is that the body heals with oxygenation. So a part of the body that gets a lot of oxygen can heal quicker than a part of the body that doesn't. So with your soft tissues, your muscles, think about cutting into a raw chicken. You would have a whole bunch of blood, right? And so your muscles have blood flow, and therefore they heal pretty quickly. Where if you cut into a raw chicken and you cut into the tendon, you'd have very little blood, and so it takes longer for your tendons to heal because they have very little blood flow. And almost no blood flow goes to your ligaments, and therefore they take even longer to heal than a muscle tear. So we're taking a look at the hand, and you can see here where your long tendon, it's your tendon that's connected to the bone and way down into the muscle, which is in the forearm. And then your ligament is running in the opposite orientation as the tendon, and your ligament is holding your tendon in place. So we think about this as like similar to guides on a fishing pole. If you didn't have those guides, the line would flap all over the place. So your tendons are collagen strands, which are lined up or bundled next to each other. They have very high pulling or tensile strength. They're able to withstand a lot of forces. And the primary function of that tendon is to transfer forces. So when you have inadequate rest, you can have lengthening or stretching out of those tendons and deformation, and they may not return to their normal length. And so this is another example that I use sometimes in class, and you can see how the cable is wrapped around itself, and that's what a tendon structure would look like. Then you have your tendon sheath, which is over the top of your tendon unit, and it's anchoring your muscle to your bone. So this is an example of giving you another idea of what a tendon would look like inside of your body. It's all these fibrous cables that are wrapped really tightly together. They have a sheath that's on the outside and some fluid in there to aid in lubrication. So just like a wire cable, if one of these became frayed and started to unravel, that can cause irritation in the tendon sheath and therefore lead to larger problems down the line. Tendons are surrounded by a protective slippery sheath called tendon synovium. Tendons glide or slide inside the sheath because of the synovial fluid, and passage of blood and nerves into the tendon is through the sheath. So damage to the sheath causes an increase in irritation, can cause an increase in friction, can also cause thickening to the tendon sheath, and therefore it's harder for blood to get through to the tendon and causes it to break down over time, or causes it can take a lot longer to heal. So talks about the cumulative effect of work-related musculoskeletal disorders. So being able to change or put an intervention in place before somebody becomes injured, even if they just feel pain and discomfort, can really reverse the detriment to the musculoskeletal system. Ligaments are soft tissue structures that connect bone to bone. A joint capsule is a watertight sac that surrounds a joint and is made up of that connective tissue, which is that ligament structure, and then filled in between all those different spaces is synovial fluid. So here you're looking at a cross section of the hand, and therefore you can see that you have the joint capsule, which is engulfing the hand. It's filled with synovial fluid, and it creates this lubrication inside so your bones don't rub bone on bone. So I'm going to talk briefly about the stages of development for a work-related musculoskeletal disorder. So there's generally 3 stages. Stage 1, there's discomfort and fatigue. Stage 2, you have pain and the initial injury. And stage 3 is when you're in a disability and you've caused somewhat permanent damage. So stage 1, aches and discomfort and fatigue affect somebody during their normal working hours, but with rest and days off, the aches, the pain, the fatigue goes away. People feel no drop in performance. They can still work, although they may feel some discomfort. It may persist for weeks if they change their job or they're able to change something about those physical workplace risk factors, maybe lowering a keyboard or raising the working height of a surface so that you don't have to bend over. Then because there's been no damage, it can be reversed. And so the first stage is that you recover with rest at night. You wake up in the morning and you're not carrying your pain with you. Whereas the second stage of a musculoskeletal disorder, you have the same symptoms, ache and fatigue, but they occur earlier in the work shift, and your sleep may be disturbed, so you may have an increase in pain. Or it doesn't settle at night, so you wake up the next morning and you still feel your pain or discomfort. Some doctors use the distinction between discomfort and pain as pain affects your after work activities, where discomfort tends not to. For pain, you may take something like over-the-counter medication, and you may not go and play golf or work in the garden because of that. So your performance starts to become decreased or reduced. It lasts over a series of months, and potentially, if it continues, it may be irreversible. It depends on how damaged that part of the musculoskeletal system is, and really which part of the musculoskeletal system we're talking about. Muscles heal pretty readily with rest. Ligaments may take a really long time to heal. We may not feel the pain because they don't have blood vessels in there. We will feel it once it inflames, but because we don't feel the pain, we keep working and pushing through it, and we're causing more damage. So the final stage, the third stage, is that symptoms persist even while resting. So I'm not going to work and my back still bothers me. Pain occurs while performing non-repetitive movements, and pain occurs frequently. Person is unable to perform even light tasks, and this means that it's typically irreversible. although there can be interventions that decrease the amount of pain that people have or enables them to be able to work at some type of limited capacity. So I'm going to talk now a little bit more about site-specific musculoskeletal disorders. So we're going to only talk about the upper extremities, but keep in mind that these disorders can really occur anywhere in the body. So for example, carpal tunnel syndrome occurs in the wrist, and as you see here, tarsal tunnel syndrome can occur in the ankle. So the upper extremities and the lower extremities, they pretty much mirror each other. They are very similar in their anatomy and their physiology. So what can occur in the upper extremities can occur in the lower extremities. Typically, upper extremity musculoskeletal disorders are related to repetition and posture, whereas in the lower part of the body, it's force, posture, and compression. So this is a image of the hand, and you can see that you have the tendon that runs very close to the surface of the hand. This is your extender tendon, allows you to open your hand, where your flexor tendon has you close your hand. So these would be your closing your hand would be your flexor tendons. Even though the finger is extended, the text threw me off there a little bit because it wasn't making sense, right? Close our hand is to flex. You close your hand with the tendons on the inside, whereas you open your hand with the tendons on the outside. So here's your tendon, and here's your ligament. And your ligament holds that tendon to the bone. And what allows that tendon to glide is the synovial fluid inside of the tendon sheath, and it reduces that friction. Oops. So trigger finger is the first disorder we're going to talk about, and trigger finger, there's lots of things that can cause it, but it's constant irritation from the tendon repeatedly sliding through the pulley, or from direct compression that causes the tendon to thicken and swell and creates a nodule or a bump that gets caught and gets locked into place, and it can't slide or go underneath that pulley. And so if you've ever seen somebody with trigger finger, their finger will actually get locked down in the curved position, and then they have to pull it to straighten it back up again. And what's happening is that bump or that nodule is getting caught in between the pulleys, and the tendon can't slide through anymore. So historically, trigger finger was from repeatedly pulling the trigger on a revolver. Some people who have these types of disorders, painters using small paintbrushes, dental hygienists, any task that requires repetitive use of gripping a hand tool, especially if it's an angular tool, it doesn't have a soft cushion on it, and you have direct compression of that tendon. Even long hours of gripping a steering wheel can cause trigger finger.
As it bends, the finger is straightened with a pop or snap. The flexor tendon becomes thick and irritated as it slides through the tendon pulley, causing a thickened nodule and triggering of the tendon. Discrepancy between the diameter of the tendon and the size of the pulley, causing the triggering. Symptoms: pain located at the palm at the base of the finger. Tenderness at the A1 pulley. It occurs more in women, more in diabetics, also in rheumatoid arthritis. It can be from repetitive injuries or occupational. Locking can occur when the tendon is unable to pass through the sheath. As the tendon becomes inflamed, it gets caught.
The carpal tunnel. The carpal tunnel is made up of so if you laid your hand on the table, your palm facing up, Your carpal bones are at the bottom here, and then you have your transverse ligament, which is along the top. And running underneath your transverse ligament are your flexor tendons, which allow you to close your hand, and your median nerve. And so as you can see, you have this soft structure that can easily become compressed on top of some more soft material that can easily become compressed or irritated on top of something that's really hard, right? So you have your bones at the bottom. So your carpal tunnel is just an opening created by your carpal bones and your transverse ligament, and in between there you have your median nerve and your flexor tendons. And as you can see, the median nerve runs really close to the surface of the skin right underneath that transverse ligament. Carpal tunnel syndrome is a condition where the carpal tunnel becomes smaller because the tissue inside becomes larger. So it swells somehow. Usually carpal tunnel syndrome is caused because of poor posture. So because of poor posture, if you flexed your wrists back as far as you possibly can and then push them into the edge of the desk and you try to move your fingers that way, you'll start to feel a pins and needles sensation. So it's not the repetition that causes carpal tunnel syndrome, it's the poor posture and the compression that can cause carpal tunnel syndrome. So something inside of this structure becomes inflamed. Either the median nerve itself becomes inflamed because you're putting direct pressure on it when you're pressing into that transverse ligament, or the tendon sheaths become inflamed, or the tendon itself, or you lose your synovial fluid, which increases the friction. And that's why it's a syndrome, because any of these things can cause the pain or the discomfort associated with carpal tunnel syndrome. I am a firm believer that carpal tunnel syndrome is 99% avoidable in an office setting because you can do something to the work environment to change their awkward posture, to change the compression. Carpal tunnel syndrome is not caused by repetition. It's caused by the other physical workplace risk factors. Repetition can contribute to it, but it's not the primary cause. If you were in a neutral posture, the repetition wouldn't cause carpal tunnel syndrome. But if you're typing with your wrists jammed into the edge of a sharp desk, or maybe you're using hand tools and you're resting your wrist on that surface, that's what causes that carpal tunnel syndrome. So recognize that you have a very soft surface here that's easily compressible, compressed into something that's hard. So our signs and symptoms: tingling or numbness that is felt in the fingers and the hands, shooting pain in the forearms or sometimes in the wrist, and then you have that loss of grip strength. You have difficulty grabbing onto things. Most people have trouble because their median nerve, you can see how it goes through the middle finger, so they'll have problems with that middle finger. It also branches out into the ring finger and somewhat into the index finger and the pinky finger. So your median nerve covers a lot of area. So any one of these fingers can hurt, but it's that pain or discomfort in the wrist. So this picture shows a pretty good indication of the increase in pressure with the change in your wrist posture. So all you have to do is change your posture, not actually have any compression at all, and it creates this internal compression inside of your carpal tunnel. So how do you prevent carpal tunnel syndrome? Posture, 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 right? Neutral posture is the best posture to be in if you want to prevent any of these work-related musculoskeletal disorders. So fingers, hands, wrist, and now we're looking again at the wrist, although ganglion cysts can develop on the hand as well. So a ganglion cyst is a sac that develops. It's a weakening of the ligament structure that then fills up with synovial fluid, and it creates this bump. So it could be on the inside of the hand, or it can be on the back of the hand. It's typically associated with people who have highly repetitive motions of their hands combined with force. So, for example, a dental hygienist, because you have this weakening in the ligament structure and it fills up with synovial fluid. A ganglion cyst may hurt, it may not hurt. It can be debilitating, it may not be debilitating. It depends on the size of the cyst and where it is in the hand. I had a woman in class one time who had ganglion cysts on the back of her hand, and it was because she was a swimmer and they felt it was caused by her pushing off against the wall really forcefully. And unfortunately for her, the ganglion cyst developed a leg, they call it, that wrapped around a nerve, and it was quite painful for her. They can drain them by sticking a needle in and draining the synovial fluid out, although sometimes it comes back. There's some anecdotal evidence that shows if you have a decrease in your salt intake, that'll reduce the retention of fluid and bring down the size of the ganglion cyst. Historically, they were called Bible bumps because if you got one, they would pick the biggest book in the house and whack it with it, and it would burst the cyst, and then it would go away. But that can cause some severe damage to your hand, so we don't. That is not recommended. I just thought it's kind of neat to hear about historically what these were called. So vibration-induced white finger or hand-arm vibration syndrome. Calling it Raynaud syndrome is a misnomer. Raynaud syndrome is naturally occurring, where vibration-induced white finger or hand-arm vibration syndrome is caused by being in contact with some kind of vibrating source. So vibration is a really nasty risk factor because it causes a drop in blood volume. So your blood can't get to the end of your blood vessels anymore, causing a decrease in circulation. If it occurs long enough, you can have a thickening or edema of your skin. The blood vessels will die off, and then your fingers, like you see here, will turn white, and because there's no blood getting to them anymore. A lot of times they are cold to the touch, and then when you're in a cold environment, your hands will hurt. Vibration-induced white finger, the higher the exposure, the quicker that it can come on. It's one of the few work-related musculoskeletal disorders that is irreversible. Once you have this damage to your blood vessels, you don't typically grow new ones, although there is some new therapy out there, but I'm not quite sure how effective it is. The research isn't completely fully supportive of it, so we're still under the impression that it's an irreversible condition.
If you use a drill, a saw, an angle grinder, or other tools, you could be vulnerable to vibration white finger. This happens when shaking and vibration from tools reduces the circulation to your fingertips. This can get worse in cold weather, when your circulation is naturally low. There are 4 key symptoms to watch out for. Tingling and numbness in your fingers. Not being able to feel things with your fingers. Losing strength in your hands, meaning you may not be able to pick things up. Your fingertips could turn white and then red in cold, wet weather. Attacks may typically last up to 15 minutes, until the hand starts to get warm again. The more serious the condition is, the longer it will take for your hands to return to normal. To protect yourself, keep warm at work. If you're working in the cold, make sure to wear your gloves. Exercise and massage your hands to improve circulation. Avoid touching cold objects, especially if you're not wearing gloves. Make sure you're using the right tool for the job. The tool should be well maintained, and you should avoid using it for long periods. Try to use equipment for quick, short bursts if you can. And remember to take a break if you hit your limit. You can find out more about limits by following the link below to the Geotechnics website, where you can also learn more about other health and safety topics in the construction industry. Just follow these simple steps to stay safe. Together, we can wave goodbye to vibration white finger.
So your nerves that control your hands, they exit from your spinal canal, and they exit through your C6, 7, 8, and T1, as you can see them right here. They come from the back of your body through to the front. They go over the first rib and underneath your clavicle. So this is actually a point where these nerves that control your hand can become pinched or impinged. And so you can see your medial nerve runs through the middle of your arm, and that goes again, so if your palm side is up, it's on the palm side of your hand through your transverse ligament. Your ulnar nerve runs through the bottom back underneath your elbow. Your ulnar nerve, you know where that is because you can, when you hit your funny bone, you're actually hitting your ulnar nerve. So that's on the back side, and it runs right over that bony protrusion there. And then you have your radial nerve. Your radial nerve wraps around your arm and goes into your thumb. So you can see the areas of sensation related to where the nerve is enacting in which part of your hand, right? So your medial nerve covers most of your hand, your ulnar nerve, your pinky, and then your radial nerve is the back side of your hand. So where you feel that pain or sensation could be which nerve is being impinged. So what else I'm trying to explain to you here is that if you have these postures where people are, for example, resting on their elbows and they're pulling their shoulders up like in a shrugged shoulder position, they can be taking their first rib, jamming it up against their clavicle, and that can cause impingement of one of these nerves. So you might have that referred pain like, oh, I have pain in my wrist or pain in my thumb, and you think it's related to carpal tunnel syndrome or resting your elbow, but really it's related to the impingement around the neck area, in the front of your body, the clavicle area I meant, or it could even be problems with the cervical spine or the thoracic spine. All this comes into play together. So why the neutral posture is so important, because impingement of one of these nerves can cause pain or discomfort someplace else, and it might be hard to focus on what needs to be changed in order to stop that pain or discomfort. So if we take a closer look at the elbow, I like to take a close look at the elbow. It's one of the most complicated joints in the body. I mean, where else can you have almost completely a full rotation as well as bending and flexing of the elbow? So these two bony protrusions here are called your epicondyli. Your epicondyli are where all the tendons are attached, and then it's where the tendon is attached to the muscle in your epicondyli. And you can see your ulnar nerve, which runs in between, or it doesn't run in between, but it runs right on the outside of that bone, right on the part where you would rest your elbow on a hard surface. You can actually cause this to, the nerve can become irritated from constantly snapping your arm out, like if you were hammering something, and because this nerve, it snaps into this groove, it can become irritated. Then you have your medial nerve, which runs through the center, and your ulnar nerve, which runs right on the inside, which can become trapped if you carry stuff on your arm right in that area, or you have your arm constantly bent through. So each nerve passes through a ligament tunnel, and because the elbow is bent most of the time, the nerves can be bent as well. And so things go back to their resting shape once you rest, But if you have long durations with your arm outstretched or your arm bent, you can have deformation, elongation, and they don't go back to their resting length again. Epicondylitis, there's two types of epicondylitis. There's lateral epicondylitis, which has also been caused tennis elbow. So think about if you were doing a backhand in tennis and you're extending your hand back, the forearm muscles which are doing that motion is where you would ache, close to your epicondyli, which is close to your elbow. So that's on the top and the outside of your arm, so the not the palm side, the other side of your hand. And then medial epicondylitis, or golfer's elbow, is caused by repeatedly flexing your hand forward. So if you were painting, you may have epicondylitis or golfer's elbow. So it's caused by that flexion, where tennis elbow is caused by the extension. But either way, the forearm muscles that are involved in every motion that we make, gripping, squeezing, lifting, are attached to the wrist and the elbow. So they're attached via a tendon, but those forearm muscles are in your forearm. If those muscles are overloaded or overstressed, they can partially tear. Frequently, the muscles or the tendon attachment becomes injured at the insertion point right near the elbow. Repeated strain on the muscles that extend or flex the wrist or the finger from repeated use or carrying heavy loads can cause epicondylitis. So epicondylitis is, itis is inflammation of your epicondyli, are those two bony protrusions on the inside and the outside of your elbow. And although it's not related to the bone, it's related to the tendon that attaches there at the elbow. So you can see that attachment within that area. So I have my arm here again. You can see this is the inside of the arm. All the different rotations that are able to happen when you're in your typing posture, how your ulnar actually crosses over your radius. Your epicondyli, these two bony points, are where the tendons attach, run to the muscle, and then you have another tendon that's attached and runs into the hand, into the bone. So your tendons attach muscle to bone, where your ligament comes around and attaches bone to bone. And your tendons in your hands are very long, which enables us to be fast. They're very long, they run through the hand, and we're able to fire off all those different muscles. So I think maybe you can see that here, where you would have your ulnar nerve running through this area here, right on the outside in that bony protrusion, your medial nerve running through the center, and your radial nerve crosses over the arm and allows you to radiate. And here you can see the carpal bones, and your transverse ligament would go right across the top there. Your flexor tendons would come right on the inside, and that medial nerve would be right underneath your flexor tendon. So if we look at, now we're moving to the shoulder, where you have your humerus attaches up into the shoulder area, very complicated. I've talked to physical therapists before who said one of the hardest injuries to recover from is a shoulder injury, because every move that you make, you move your shoulder girdle. You have over 150 different bursas in your body, and a bursa is a sac filled with fluid that stops those two bones from coming in contact with one another. So in this diagram here, you can see how the bursa stops your clavicle from coming in contact with your humerus, as well as coming in contact with your first ribs, especially when your arm is raised. So your bursa allows you to decreases the friction and allows you to be able to make motions without having bone-on-bone attachment, or bone-on-bone impaction, I should say. Bursitis of the shoulder is very common in folks over 40 who work with their hands above their head. Auto mechanics, when I worked for the Navy, most of our artisans who worked on aircraft work with their hands above their head. plumbers, well, plumbers are down low, but electricians, HVAC workers, and from constantly having your arms raised and pressure on your bursa, it becomes inflamed. You lose that gliding capacity of having your bones glide against one another because the bursa is inflamed, and the irritation of the bursa is increased with the more movements that you do. So it can result from repetitive motions with your hands above your head, or you in a hunched up shoulder, clavicle up position, or from repeatedly bringing your hands above your head, or prolonged static postures of holding your arms above your head. Thoracic outlet syndrome. Thoracic outlet syndrome occurs, and this is really kind of a neat cross section here where you can see your clavicle and you can see your first rib, and then these are your nerves that are running again over your first rib and underneath your clavicle. They exit out the side of your neck, and they can become impinged there from working with your head in a twisted posture off to one side, or what thoracic outlet syndrome is when you have your first rib is brought up against your artery or your vein that is again traveling along that same path that your nerve is, and it could be caused by lots of different things, but that's what thoracic outlet syndrome is. It's the compression of your artery or your vein in between your first rib and your clavicle. So it can be caused by having an extra rib. It can be caused by being in a car accident where your seat belt comes across that area and causes your clavicle to compress up against your first rib. It can be caused by repetitive or static motions of holding your arms out in front of you, or in a slouched posture where you drop your head forward. This woman was experiencing thoracic outlet syndrome. She's doing environmental monitoring, so she's weighing samples inside of this glove box, and she had to be really careful when she had her hands inside the glove box to not rest on the rings of the gloves where the gloves come in contact with the box. And because of that, you can see how her neck is craned forward, and she'd hold her shoulders up slightly, and it caused that impingement in that area. And then I thought I'd just show you the solution here that we came up with, since there wasn't a lot of solutions in this particular learning unit. And instead of using a glove box, the Navy was able to purchase a small environmentally controlled room, so she'd be able to go into that room and do her weighing of her samples instead of using the glove box, which got her out of that position. Shoulder disorders are most frequently caused by prolonged exposure to static postures. The optimum posture of the shoulder while upright is when the arms are vertical, so your elbow is in line with your hip, your arms are about at a 45-degree angle, and you roll your shoulders back and down, which I think that over time, we're going to see more problems with things like thoracic outlet syndrome, problems in the cervical spine from rolling into our tablets, our phones, and our devices. And my son recently was at a wrestling match, and I won't let him use a device while he is there. But when I looked down the row of children, that's all I saw was the back of their necks. Nobody was looking up at the wrestling match. They were all looking at their devices. So this can be an area where the change of the risk factors causes a change in our disorder. And so there is really good epidemiological evidence between static loading and shoulder disorder, as well as loads in the hands that are held out from the body and problems with your shoulder. I mean, it's an area of the body in which every move that you make is impacted by the shoulder. So these slides list some summaries for you to review. You can look at the PowerPoint presentation if you wanted to take a look at them, but it's just a review of the different work-related musculoskeletal disorders, the symptoms, and the ergonomic risk factors associated with each one. So elbow, shoulder, fingers, hands, and in summary, I'd like to say thank you for listening to upper extremity work-related musculoskeletal disorder. And the goal is to fit our workstation, our tools, and our tasks to the worker to prevent injury, increase productivity, and worker morale. I hope you have a pleasant day.